Welcome to Dr. Science. So today we are going to talk about acute suppurative otitis media. As the name suggests, whenever you hear the term otitis, it is inflammation, and media means middle ear cavity. So inflammation of the middle ear cavity is known as otitis media. Now what is meant by suppurative? Suppurative means whenever there is pyogenic bacteria, and this bacteria will produce a lot of pus. Now this pus producing bacteria such as your streptococcus pneumoniae, which produces a lot of pus in the middle ear cavity, are called as your suppurative organisms. I hope you are clear with the term. Now, in order to understand this acute suppurative otitis media, we have to know the contents of the middle ear cleft. So, middle ear cleft is nothing but the hollow spaces of your temporal bone. So, middle ear cleft means the hollow spaces which are present in your temporal bone. We will draw the diagram here. So as you can see here, this is the mastoid process. This is the mastoid bone. Now the mastoid is a part of your temporal bone. Here is your temporal bone. So usually the mastoid have these small air cells present inside of it. Okay, there are small air cells which are these hollow cavities which are present in the mastoid are filled with air. Okay, hence they are called as your air cells. And one of the biggest air cell is present in your mastoid, and this biggest air cell is called as your antrum. Okay, not only mastoid contains air cells, even the temporal bone also contains air cells, small air cells. I hope you are clear with this. Now, if you are following my lectures, I already told you that we have a middle ear cavity. What is this? This is your middle ear. Now, this middle ear is connected to the antrum via a tube, and this tube is called as your Otitis. What is the tube that is connecting the antrum and the middle ear? It is the Otitis. Not only that, the middle ear is connected to the nasopharynx via tube, and this tube is your eustachian tube. Okay, so once again I am repeating, the antrum, which is the largest air cell of mastoid, is connected to the middle ear by Otitis, whereas the middle ear is connected to the nasopharynx by eustachian tube. Now we will try to know what is happening in acute suppurative otitis media. Once again, we will draw the mastoid process or the mastoid bone, and here is the temporal bone, and one of the largest air cell is the antrum, and here we have the middle ear, and here we have the nasopharynx. So the antrum is connected to the middle ear by Otitis, right? And similarly, nasopharynx is connected to the middle ear by eustachian tube. Now imagine there is infection. Unfortunately, this person got a nasopharyngeal infection by streptococcus pneumoniae. which is a pyogenic bacteria. Obviously, the Streptococcus pneumonia or this bacteria will travel from the eustachian tube, and from the eustachian tube it will enter into the middle ear. Whenever the middle ear is infected, it is called as your otitis media. And once it infects the otitis media through the Otitis, it will enter the antrum cell, which is present in the mastoid. Okay, it will infect the antrum air cell, which is present in the mastoid. Whenever this mastoid is getting infected, it is called as your mastoiditis. So first it will infect the middle ear, it is known as your otitis media. After that it will infect the antrum, which is a part of your mastoid, hence it is called as mastoiditis. Not only that, I already told you there are a lot of air cells present in the temporal bone also. In the temporal bone, especially in the petrosal part of temporal bone, there are a lot of air-filled hollow cavities or air cells. So what will happen? They are also getting infected, and whenever this infection spreads to the temporal bone or the petrosal part of temporal bone, this is called as your petrositis. I hope you are clear with the terms. So a simple middle ear infection can infect mastoid and the petrosal part of the temporal bone also, because all these things are interconnected with each other. Now, as I already told you, what is meant by a middle ear cleft? These are your hollow air-filled cavities that are present in your mastoids. So what is the first one? The first one was your eustachian tube. The second one was your middle ear. The third one was your antrum. And fourth one was your mastoid itself. And fifth one was your small air-filled cavities that are present in your temporal bone. I hope you are clear with this part, because all these constitute for the middle ear cleft. I hope you are clear with this stuff. So in acute suppurative otitis media, there is nasopharyngeal infection by Streptococcus pneumonia, and this is spreading to your middle ear, and from the middle ear it is infecting the antrum, and from the antrum it is going to the temporal bone, especially the petrous part. Okay, so how would the ear examination would look like in this patient? So we will draw a tympanic membrane here. So this is the tympanic membrane, and this tympanic membrane will be having a lots of dilated capillaries. So this tympanic membrane will be having a dilated capillaries, which will look very red on examination. You can say red dilated capillaries, which are visualized on your ear examination, and this is known as your cartwheel sign. Okay, and eventually some people may get bulging of the tympanic membrane. Okay, since lot of pus will get accumulated, this will start bulging outside. The tympanic membrane will start bulging outside. I hope you are clear with the term. Next we will talk about the treatment part. Usually we do medical management. In medical management we give amoxicillin. If medical management fails, then we go for surgery. that is myringotomy. Now what we will do in myringotomy, we'll try to understand here. So usually this is the tympanic membrane, and this tympanic membrane is divided into 4 parts. Let's draw a circle so it will be easy for us. So this is the tympanic membrane, and this tympanic membrane is divided into 4 parts. One is your anterior part, and this is the posterior part. This is the posterior superior, and this is the posterior inferior, whereas this is your anterior superior and this is anterior inferior. So what we will do, usually most of the dilated capillaries will be presenting inside in the posterior inferior part. So what we will do, we will perforate, we will cut open this. We'll cut open the posterior inferior part, and cutting of the tympanic membrane is called as your myringotomy. Okay, I hope you are clear with the term, but we have to follow a small flow chart here, so please follow this. So usually the patient, this is the patient, this patient came with a bulging tympanic membrane. Now unfortunately this patient neglected his health, and he said, I don't want treatment, I don't have the money for the treatment. Okay, so what will happen, eventually there will be perforation of tympanic membrane. Okay, so there will be first there will be bulging of the tympanic membrane, and there will be ear pain. Due to this bulging, there will be ear pain, and the patient will come to you, but unfortunately this patient is not able to afford the treatment. So what will happen, there will be perforation of the tympanic membrane. After the perforation of tympanic membrane, he will come again, and he will say, I need treatment now. So what you will do, you give amoxicillin. You give amoxicillin. Now when you give amoxicillin, there will be decreased in the bacterial load. Now whenever there is decrease in the bacterial load, this perforated tympanic membrane will eventually heal itself. Okay, the perforated tympanic membrane will eventually heal itself when you give the treatment. Now similarly, if there is no treatment and there is perforation of the tympanic membrane, and unfortunately even after there is perforation of tympanic membrane, this guy is absolutely devoid of money, and he cannot afford the amoxicillin. So what will happen, the bacterial load will increase in this patient, and this increased bacterial load will cause permanent perforation of tympanic membrane, and eventually after 3 months this can cause chronic suppurative otitis media, which I will be discussing in my next video. I hope you guys like it. Thank you guys.